If you've ever been to a physical therapist, physician, or other healthcare provider for shoulder pain, you've probably been told that you have shoulder impingement and that's the cause of your pain. But the question is this really true? In today's video, we're going to be covering exactly what shoulder impingement actually is and whether or not it's likely causing your shoulder pain. Basically, shoulder impingement is pinching of the soft tissues of your shoulder, such as tendons and bursa, against bones that form the actual shoulder joint, mainly the head of the humerus and the acromion process. This pinching has been said to be abnormal and the cause of fraying of those tendons, irritation of those soft tissues, and eventual shoulder pain and injury. This was thought to be especially true in people who had differently shaped acromion processes that were more hooked or pointy. This was the way of thinking of a lot of healthcare providers in the past, but luckily we know now that this actually isn't all that true, and shoulder impingement probably isn't causing your shoulder pain. We now know that shoulder impingement is actually a pretty normal process that happens in basically everybody's shoulders as you're raising your arms over your head. Because it is a normal part of the shoulder mechanics when you're moving your arm over your head, and because it happens equally in people with and without shoulder pain, we don't actually consider it a diagnosis or pathology anymore. This isn't something that we figured out quickly. It took time and many different types of studies for us to come to this conclusion. The first type of study that helped us come to this conclusion was looking at surgical removal of the piece of bone that caused the shoulder impingement in different types of care such as rest, NSAIDs, and sometimes exercise and rehab. Studies like this basically show that there's no difference in change of symptoms in people who had actual removal through surgery of that bone that causes impingement and people who went through things like exercise, rest, and activity modification. So if actually removing the source of shoulder impingement doesn't change the outcomes that people with shoulder pain have compared to just doing other things like exercise and taking NSAIDs, then we can't actually say that shoulder impingement is the cause of pain. Another type of study looked at the actual mechanics of the shoulder as you're moving your arm up and overhead. Most people who have been diagnosed with shoulder impingement have the most amount of pain when they're moving their arms for about 90 to 120 degrees of elevation, and then at the very top of the range of motion. However, these types of studies have shown that the peak shoulder impingement typically occurs at about 60 degrees of elevation with internal rotation and begins as early as 30 degrees of elevation, which is quite a bit different than the symptom pattern that people with shoulder pain have. So if surgical removal of the piece of bone that causes this impingement doesn't reliably produce better results in other forms of treatment, such as exercise, NSAIDs, and activity modification, and impingement is actually a normal part of the shoulder joint mechanics, then we can't say that it's a cause of shoulder pain or injury in anybody reliably. If you're looking for help with shoulder pain that's stopping you from doing activities that you love, then click the link below to schedule a free phone consult with one of our experts to see if we can help you out.